One of the problems public health authorities face when informing the public is to strike a balance between secrecy and transparency. On the one hand, authorities don't want to cause unnecessary fear or confusion. On the other hand, they don't want the public to feel that they're being lied to or denied access to important information. Sensitive information that authorities struggle to decide on whether to disclose are, for instance, information about the amount of vaccines available and knowledge about possible side effects. Today, communication about epidemics and pandemics are mainly one-way communication coming from authorities and experts. They possess all the information about the effectiveness of medicines and spread and severity of diseases, and they are making the decisions on preparedness, response and recovery plans in case of an epidemic or pandemic outbreak. But it is possible to take another approach and involve citizens. Public health authorities could communicate with the public in different ways and, for instance, take concerns about side effects into account, even if this has not yet been established as a scientific fact. The vaccine against the HPV virus for young girls is one example, where girls experience side effects that are not scientifically proved. Preparedness plans could be based on input from local communities about their desires and needs in an outbreak situation, and they could provide authorities with specific knowledge about their community. The public could have influence on how resources like vaccines are distributed, or on when and where to take precautions like closing schools or suspending public events. On the one hand, citizens have a right to be involved in decisions that affect them, and they have valuable local knowledge which can improve the efficiency of a response to public health threats. On the other hand, involving the public can make it more difficult for the authorities to work effectively. In fighting epidemics and pandemics, there can be a conflict of interest between public health authorities and the pharmaceutical industry. Industry wants to sell its products, and this could lead to overemphasis on risks of a disease and the need for a vaccine. The 2009 H1N1 or swine flu pandemic is one example. Multinational corporations' donations pay nearly 80% of the World Health Organization expenses. The scientists who advised the WHO to proclaim the so-called swine flu a pandemic had close ties to companies that manufacture vaccines and antiviral medicines like Tamiflu, but this information was withheld from the public. The World Health Organization handling of swine flu influenced the general understanding of the risks in a situation with a pandemic. A German study showed that during the peak of the swine flu, only 18% of participants stated that they perceived the risk of pandemic influenza as high. This proportion fell to 10% in January 2010. The loss of confidence in health authorities had a strong impact on seasonal flu vaccinations too, and it added to growing public mistrust towards other vaccinations such as measles and polio. The pharmaceutical industry is also racing to develop treatments or vaccines that will stop the epidemics, and scientists attempted to offer experimental treatments to people suffering from life-threatening illnesses like Ebola. This was the case with the American doctor Kent Brantly, who caught Ebola while he was fighting the disease in Liberia. He treated himself with an experimental drug, which was years from getting an approval from American health authorities, and he recovered.
Today is a miraculous day. I'm thrilled to be alive.
Offering experimental treatments is ethically questionable since side effects, as well as possible positive effects, are unknown. In the case of Kent Bradley, he's a doctor himself and can weigh the pros and cons. But in other cases, doctors might be motivated by a desire to be the first to document health effects of a new treatment, and this could tempt them to pressure patients into agreeing to experimental treatment. Transparency in public health policy can be difficult since public health authorities need to be able to work in peace during an outbreak. But on the other hand, the public trust in authorities suffers when the public feels misinformed or held in ignorance, as in the case of swine flu.